Hello, everyone, and welcome back to another episode of Acupuncture is My Life. Now, I have a quick question for you guys. This should be pretty interesting. And that question is, there are many of you who are on prescription drugs or even taking over-the-counter medications, right? And I wanted to ask you this. Are you aware that there are medications out there that can increase your risk of a heart attack? Yes, there are. And it's important that you're aware of this because, a shock to many individuals who see colleagues of mine around the world for acupuncture, as well as even individuals who come into the Acupuncture is My Life clinic here in New York City. A shock that certain medications that they're on, they're informed, it can increase their risk of heart attack. And many times I'll recommend they go back to see their prescribing doctor and discuss that. And they usually do, and it's usually best that all acupuncturists recommend that when you're aware of certain side effects that can be life-threatening to a patient. These things are important for a patient's overall well-being. Okay? Because, seeing an acupuncturist is a major part of practicing a heart-healthy lifestyle. It really is. Because as many of you are aware, the heart is responsible for moving blood. And how does this blood move throughout the body? Does any of you guys remember from past episodes? What moves blood? I'll give you a few seconds to think of that. Some of you are right. Qi. You hear me speak of qi in blood, the importance of the harmonious flow of qi in blood throughout the body. Qi is the energy that moves blood throughout the body. You can feel the strength of qi in moving the blood when an acupuncturist does pulse diagnosis. Now, yes, they'll do tongue diagnosis and others, but pulse diagnosis. We can assess the state of qi and how well, your blood is flowing throughout the body and so forth and so on. Now, in the doctor's office, they'll check your blood pressure. But if you want a healthy heart, along with, of course, cutting back from eating modern table salt and include physical exercise in your daily routine and get a good night's sleep, acupuncture is the best move. But here, for purposes of this discussion, an important part in living a heart-healthy life is being aware, and this is if, I'll emphasize, being aware of which medications can increase your risk of a heart attack, and that's if you're on prescription drugs. Because you have stimulants out there like Ritalin, Concerta, Adderall, to name a few. But now age kicks in when you're taking certain drugs or taking stimulants. So, like if you're an older adult, I don't know, if I had to throw an age out there, safe to say like older than 35. When you start taking a stimulant, studies have shown you had a 40 to 45% increase risk of heart attack, stroke, ventricular arrhythmia within the first 30 days. Within the first 30 days. Now, I know that's going to scare some of you guys, but would you be scared if you were seeing an acupuncturist for regular wellness visits, along with seeing your physician on an annual basis? I seriously doubt it. But one drug that can increase your risk of heart attack or stroke and so forth is NSAIDs, non-steroidal anti-inflammatory drugs. Advil, aspirin, Tylenol, Excedrin, and so on. Why? Because NSAIDs tend to block the production of certain body chemicals that cause inflammation. Okay? And which makes it great for treating pain as a result of slow tissue damage. Many people take it, let's say, for headaches, menstrual cramps, back pain. You're faced with all of this stuff. There's no way you should not be seeing an acupuncturist. But NSAIDs can cause huge problems, including negative effects on your heart. Why? Because NSAIDs increase your risk of having a heart attack. How does it do that? What happens is it decreases prostacyclin production, which is an anti-inflammatory marker, which can lead to an increase in blood pressure and plaque buildup, causing blockages in the heart. Yes. So if you're faced, it can even cause kidney disease, but if you're faced with dealing with headaches and back pain or whatever you may be taking NSAIDs for, contact an acupuncturist. And I discuss these things on the Acupuncture is My Life YouTube channel, So if you ever get a chance, watch the channel. There's so much that you can learn from watching Acupuncture is My Life on YouTube. Another is diabetes medication. Now, this can be sort of confusing to many. All right. There are some that they say can reduce your risk of cardiovascular disease, but there are some that they know actually increase your risk of a heart attack. Okay, and what are those? Like glipizide, glimepiride. I'm trying to think of others. And those are being sold under the brand names of Lantus, Basaglar, Levemir. Can increase your risk of heart attack relative to weight gain, drops in blood sugar below normal levels, insulin resistance. You really have to be very careful with certain medications. You have questions, your prescribing doctor, ask them. Just ask them, what are the side effects? They'll explain it to you. You have to keep in mind, it's all about your health, and that's what a wealth is. Health is wealth. It's not in a bank or in a safe. The wealth isn't in an app on your phone, and it's not in a cryptocurrency account. The wealth is also not in your wallet, your pocket, or your purse. The wealth is not under your mattress. It's not under the doghouse in the backyard. And it's not in a shoebox in the closet. The wealth is in you. Now, another surprise to many would be antifungal drugs. Yes, antifungal medications like fluconazole, itraconazole, ketoconazole. And these drugs are used to treat like vaginal fungus, nail fungus, mouth, fungal infections. But they've been known to cause abnormal heart rhythms, which can lead to heart attack. Like antifungal medications, itraconazole, or amphotericin B. They've been connected to heart problems, cardiotoxicity, including hypertension, premature ventricular contractions, ventricular fibrillation, the new onset and the worsening of heart failure as well. I mean, I don't know how many ways I could put it. You should be seeing an acupuncturist. With or without heart issues, you should be seeing an acupuncturist. Another one's like for the guys. Let's say guys, especially younger guys, are becoming more and more into, let's say, treating hair loss, which can have adverse effects on your heart health, like minoxidil solution, which is used to treat hair loss. See an acupuncturist. Could that have something to do with the kidneys? Maybe, maybe not. And I'm talking about the kidney meridian, the kidneys and its functions according to an acupuncturist. Deficiency. This could be a sign of a kidney deficiency. See an acupuncturist. You know, your heart isn't something to play around with. It really isn't. And taking these solutions to treat male baldness, as well as even women who have thinning hair, can cause heart problems such as angina, and if you're taking this and you experience chest pain, you need to seek emergency care right away. And once this issue is dealt with between your physician and emergency care, get yourself to an acupuncturist right away. And just simply make acupuncture a part of your life, okay? Because acupuncture is my life. What's yours?